Hi, I'm Jouke. I'm the founder and host of the European Software as a Medical Device Meetup group. We are a 100% free and 100% remote online meetup group, and we are sharing knowledge on software medical devices. We have about 450 people in the group right now, so it's pretty cool. It's growing fast. This is a recording of a session we did recently on January 18th, 2023. It's about lessons learned, and as we like to call it, how to start or how to start over. So people that have been active for a long time tell us what they would do differently if they would start right now. In this video that I hope is interesting, you're missing out on a couple of interesting parts, which are the breakout sessions. So we have breakout sessions in our meetups to let people mingle, get to know, share knowledge, and network a bit. And also there's interactive Q&A. So if you want to ask the presenters any questions, you can always do that if you join in person. And of course, in a video, you cannot do that. But nevertheless, I hope you enjoy this video and that it's useful to you. Let's go. So there will be still some people joining during this call, but that's okay. So like I said, we're recording this meeting because we want to have something longer lasting than just one evening. So we try to have the main sessions, anything interesting for YouTube. We ask permission for everything that you, anyone that's in the image or in the recording before you post anything. So let's start off like I usually do. Like the future is e-health. It's clearer and clearer to everyone in this field that digital devices, medical devices, are going to change the way we interact with healthcare. And that's very exciting. So you're in the right spot. But it's very difficult. And we're trying to help each other out here. Why is the future e-health? Well, there's more technology available than ever before. AI can do things a lot better than people can. And there's an aging population, so the demands for healthcare will skyrocket. And those three combined, there's only one conclusion. I'm asking for your input because we for your collaboration during this this meetup, but also after this and in the breakout sessions that we'll do in a bit, please share a lot because we need you. We can't rely on just Emma and me organizing everything here and Oliver sharing the regulatory updates. So please add value to this community. And you did, because we got a lot of interesting answers in the question that we asked before the meeting, meetup. We asked what are things that you would do or would avoid if you would start over. And I just want to highlight a couple, well, actually quite a bit. So many people said start better and more structured before you actually begin developing something. That's very common. Some people said pick the right tools earlier, like an EQMS. Someone said I'd avoid starting without the full regulatory understanding. Oh, that'd be great if you had the full regulatory understanding before you start. That's I think that's very common. Everyone wants that. Risk management to start from the design phase to actually plan stuff. Alignment between quality, regulatory, software development, and management makes sense. One interesting one was scaling too fast. So that's interesting because as a company, if you're constantly changing your processes because you're hiring people, it's hard to keep a QMS up to date. Keep good development records, essential, I think. Being too late with the technical file makes sense. And I feel really sorry for this person doing it as a single founder. That is really hard. I can see that with my founder, who's also a single founder. Then I got some interesting ones. Someone said, I'm currently building a QMS and would like to learn from others before it's too late. It's a bit fatalistic, but let's see if we can help you out tonight. Then someone said, I'd avoid doing too much too early. Well, that's very curious. I would love to hear more about that later. Someone said, I don't know yet. Well, this night is also for you. And Oliver said, building a medical device. So I'm very curious what you meant with that, Oliver. And as the next section is yours with the community and regulatory updates, please lead with that. But first, general introduction. The goal of this group is to make compliance easy. And we do that in two ways: by building a network of industry experts that are willing to help each other. We also have the Slack group of Oliver's company, Open Regulatory. Join there, and you get answers by the best people in the industry within minutes. I think we're the best. And we discuss best practices and problems that we face. So that's really what I wanted to do. Tonight we're going to do the introduction right now. Oliver will do the community regulatory updates. Then we have breakout sessions, about 20 minutes. So we'll make small groups of about 4 people. And you can tell stories and help each other out. Then we do a quick recap so people can share in the general session what you learned. And then we have 3 speakers. We'll get to them soon. And we'll ask for feedback after the meetup. I'm Jouke. I'm the CTO at Easy. I have 11 years in software experience. Well, actually, I started when I was 8, so a bit more, but professionally, like 11. 5 years of medical device experience right now. And I started this group because getting certified was pain. Like, it was not fun. And I thought, let's help other people out and make it better. Emma?
Hi guys, I'm Emma. I have about 3 years of regulatory experience, and I started in a 2-person startup, figuring everything out from the ground up, and I'm really here to share more knowledge to make regulatory more accessible.
Fantastic. Thank you, Emma. So I work at Easy. We're an online eye exam based in Amsterdam. We're currently MDD Class 1M, and we just got through our MDR certification. I hope now everything is fine, and we are getting 2A certification in a couple of months. Fingers crossed.
Hello, everybody. My name is Ale, and I'm going to use this talk to introduce myself and to tell a bit about my story, because this is my first meeting here in this community that I found, and I was, wow, this is exactly what I was looking for at this moment, and you're going to understand why. So what I want to do now is to tell about my story last year and all the challenges that I faced when trying to make something in digital health. So maybe it sounds relatable. But that's me. I'm a name, and that's me. And I was at some point I was looking to build something meaningful. And my background is in technology, especially in AI, but I wanted to get out of technology and to technology for the sake of technology and to build something meaningful. So last year I met Antonio, who is also an engineer but is specialized in marketing, and he had some experience in marketing for pharma. So it was interesting to start talking about building things related with healthcare. And everything made much more sense when someone that hasn't these skills joined, which was Elias. Elias is a doctor, and he is specialized in pain. So now everything made a lot of sense, because we were, especially when Antonio and me we're talking a lot about the problems that people with chronic pain, especially people with fibromyalgia, were facing. So we were looking for some solution to all these people that were in the like crazy in Facebook groups looking for a solution. So Elias was also trying to do something like that, and we connected and we started to build something. And so this was kind of the name that we came up to. And the concept was to build a digital therapeutics for chronic pain. We discovered digital therapeutics. We had no background in digital health before, but when we found this, we said, oh, this makes a lot of sense. When we discovered the DIGA Act in Germany, then it's like, okay, this new business model has started, and that makes a lot of sense. And it looks simpler than before to help these people. And just to give you an idea of maybe you have some idea. So this is we were trying to create and digitalize a therapy, a behavioral activation therapy to help these people, because we discovered that what they needed is just to try to get to improve the quality of life, to get to do those things that they have been eliminating, dropping from their lives because of the pain. So we decided that this was the thing that we were gonna do, and then everything started to become a challenge after challenge. First of all, we discovered that, okay, this is psychological treatment, and we have no particular idea about psychology. So then we are lacking some skills. That's right now, I see that, and I see a red flag here, because if you don't have the particular skills and you need somebody else to kind of try to build a product, that's a red flag. Also, I had no experience building mobile applications, but I felt confident. But that's also a challenge. And so I'm gonna just to go to all the challenges that we face. First is the market size. At the beginning, we saw the fibromyalgia. There were a lot of people in fibromyalgia, but if you want to really get the DIGA prescribed, you need that person to be diagnosed with fibromyalgia. So when you people that you see that there's a lot of people with fibromyalgia, but people diagnosed with fibromyalgia, there are not that much. So now we saw that, oh my God, the market size is so much smaller than what we thought before. We need to change maybe the condition, or maybe to make it available to other conditions. So this kind of tells you that you can go to very specific conditions. You need conditions that are kind of popular. Second is the marketing. I mean, even when Antonio had marketing experience, you felt, and that you had to like kind of make a deal with people that with pharma companies to really have a great distribution of your app. So this is a pain, because if you need to have a deal with a big pharma company, or maybe a small pharma company, that prevents you to really build your product and build your customers. So this is also a challenge. Also, clinical trials are a challenge. We know that this is difficult, and especially difficult if we were in Spain and we had to. Our market was in Germany, because the DIGA ad is in Germany and now in France. So now we had to change our clinical trials, and the geography was not the same. That was also a challenge. Also, interoperability is a challenge. You need to. You need your app to be interoperable, and that's not quite easy. But all of these problems, all of these challenges are big enough to tell you, or maybe you're not the right people to build this. Then when compliance comes in, everything gets bigger and bigger, because compliance tells you, you have to wait. You're not gonna have your product is not gonna be in the market until maybe 1.5 years. So all these challenges that you're gonna be trying to cope and to tackle, maybe they don't make sense, because when you put your product in the market, you're gonna see that maybe it's not that needed. So this test that you're trying to run, this company, it may not make sense, but you don't know. You don't know until 1.5 years after that. And also compliance, we know that there's a lot of opacity. There's a lot of it's pretty boring, and so this is a big hurdle. And also everything here makes the business more difficult. Everything here makes that anything that you want to, even if your product is simple, anything that you want to do makes your product a capital intensive product, because you need to wait a lot, you need to pay for a lot of external things, you need to make deals. So you need to you have all this entry barrier that is money and time, that makes it very difficult for people, because I dream of a world in which not just people with money, with a lot of investment, with big investment, can really make products in digital health. So that's kind of the thing that I want to say. And this is the moment that I'm in right now. We finally decided to drop the project, and I decided to focus on those challenges, especially compliance, because I dream of a world where shipping health products is as seamless as shipping software. Of course, always maintaining safety and effectiveness. That is very, very needed. But it's very, very difficult, and we are preventing a lot of smart people to come into digital health because of these hurdles. So as I say, I want to focus on compliance, mainly because I think it's the most the one that makes everything more more difficult, and also because there's this opacity, there's obscurity, and also there's this kind of it's very boring. That can you make it more attractive? Because when you face those two things, you see, okay, there's an opportunity to really help a lot of people when you see those things. And what I want to do right now is just to get involved in the community, to get to know you, to get to know your problems, to get to know the tools that you use. I have my my biases about what I want, what I think it's interesting here. For example, I love this company Vanta, that makes it very easy to do your audits and to do your automatic test, so the auditor can see can test quickly, can see quickly if you're complying or not. I also love all the possibilities that AI have here. We have seen ChatGPT. It's a revolution, and also when there's a lot of documentation that you need to fill, as Oliver showed, there's a big opportunity for NLP here. So that's it. That's all. It's pretty basic. It's just a story, and this is the thing that I can show right now. It's just a blog that I'm trying to write, and trying to write some articles here to really understand and all the challenges that are in digital health and how we can do something about it, especially with technology. Thank you.
Yeah, I was basically wondering, like, what I would typically recommend to people who start with a project from scratch. I mean, you not always have that luxury, but basically, like, what is the checklist you maybe should be going over in the beginning? So, I mean, obviously, like, you can't go through everything that is relevant in some way. And like earlier, we already heard that don't do everything right in the beginning. Like, I mean, I would somehow agree, but let's maybe go over that slowly. So maybe a little bit of context, kind of to give a bit more of a framing of what I'm talking about. Like, I mean, like just a traditional or typical device life cycle, like phase flow, also like with some exploration, then planning, development, V&V, and then release in the end. And like focusing on the exploration part, where you would, I guess, typically build out a prototype to test technical feasibility. Like, is it possible what you're doing? Do user research, like, is there actually any interest in what you're doing, or like run user tests to kind of get an understanding of how to build what you're working on? Research clinical strategy, like, do you need clinical data? Are there clinical data? Can you do literature-based clinical evaluation or whatnot? But also like business viability. I mean, in the end, you probably work kind of trying to set up a company or work for a company that doesn't just do that for fun. So that's kind of all in exploration. And now kind of in looking at like what to do when starting over, like having that in mind, like, so what's the ideal case, or like what would be like a kind of a reason to start over. Like when you work like on a very, like, let's say, ideal case, or like, let's say, regulatory-wise, the easy case, you have that exploration phase in which you test out whatever you want to find out, come up with good questions or good answers to your questions, and then start from basically again from scratch in the planning phase, or like from scratch code-wise. And none of the prototype code is going into the medical device. So you basically know what to build, and then you build it, like in the starting with the planning phase. I mean, that works in a very few cases, and I've worked on one product where we've done that. I mean, the prototype code was in MATLAB, and then the actual device was done in Python, actually. But for most, or kind of a lot of the products or projects, that it's not feasible. So, or like, let's say you have kind of an existing product, maybe with a kind of, I don't know, like, I mean, a history of 10 years or something, and you can't just rewrite everything. So kind of that's kind of a bit the situation that you're then typically in. And what I kind of the goal I think that you always have is like finding the sweet spot in between documentation or regulatory pain early versus later. So meaning like, I mean, you ideally, of course, do everything right at this kind of in the beginning, but also at least early on, you also need to find out what to build. And you, let's say, when you're not that experienced with regulatory work, I mean, you don't want to hold yourself back by learning everything first, but not working on the product. So, like when you're in exploration phase, typically do whatever is needed to find out. Coming to that later. With kind of figuring out the kind of technical answers and so on, and then starting with the more regulatory part, like in the planning phase. So, but also like, let's say when you're like in your submission to the notified body, and it turns out that you've forgotten important parts in your clinical evaluation. I mean, that's regulatory pain. Or like, let's say you don't have an ethics committee vote. I mean, you may not have needed one from a legal perspective, but your notified body still wants it. Like, I mean, that's something you can't really do it later. So I think as overall, like there are just a couple of things based kind of from experience that when you don't do them in time, like they either completely crash your project or lead to like a lot of delay or pain, as in money or time, or and so on. So based on that, like a couple of topics to consider. It's not exclusive, and it's probably different from project to project, but basically from those roughly from those projects worked on so far. The first is, I mean, it's not, the first one is not product or TD related, but QM culture. Like especially when you start as a lifestyle company, turning your existing product into a medical device, or you add a medical device on top of your non-medical devices, and you may have a team that's that with established processes. I mean, you may still call them processes, but don't consider them SOPs, let's say, and they're probably not written down. And let's say you have a team of 50 people or so, like turning that into like kind of setting up a QM system, and that can be pretty challenging. And like typically, like somehow like people like SOPs, or like they look at them and then they like feedback them, and like everything looks good, and then later on in the audit, when you want to see any documents or records from that, and like, no, like why would we've done it? But I mean, often like SOPs are taken as like guidance, like kind of a good weather approach, but not really anything binding. So that's the one thing. Like, I mean, when you're starting, so I mean, it's easy when you know it's a medical device and you start from scratch in a small team setting them up. I think then it's easy. But like when you are kind of a bit of a bigger team and switching into making medical devices, like just considering that from the very beginning and reminding everyone every week in some way that this is important. Otherwise, like the audit won't be any fun. I mean, not that audits are fun, but they can be more and less fun. That one, now getting into a bit more specific. So I mean, there's a lot about software documentation that you may need to do, but I mean, at least for low to medium risk devices, like let's say software safety class A and B, where you don't have to document every single little bit or plan every bit and so on. Like, let's say typically software requirements can be done retrospectively. I mean, that's not fun. You don't want to do that, but it's often just the fact that you have to, or architecture. I mean, you can draw an architecture diagram after the fact. But let's say you have a legacy code base, and then you have to come up with code reviews. Like, I mean, that's really not fun. And like, I mean, of course, you can do like a code review of your whole code base later on, but well, no one wants to do that. So typically, like, if you start out and you're not necessarily sure whether what you're building will be a medical device or not, but there's a certain chance that it will. At least having, like, let's say having code quality guidelines, having a code review process set out and following that, that's typically like reducing your pain later by a lot. Because I mean, that kind of reproducing that, it's not that very straightforward. I mean, writing. Yeah, you want to say something? Yeah. Okay. Where was I? So yeah, I mean, obviously, oh, okay. I mean, if you're sure that that's not a medical device, obviously you wouldn't be here. But like, that is like the one thing that I think makes sense. And like, otherwise, like, I mean, typically everyone does code review, but code review often means something like, I'm on my way to lunch break, and my colleague asked me to quickly have a look, and I had a quick look, and the code exists, so it's reviewed. I mean, anything from that and up to like a really diligent like review, and it's just like having defined what it means, having everyone in the team on board to that. Like that, I mean, having that in place early, typically helps later on. Obviously, not possible if you have a legacy code base from times when it just wasn't clear that it will be a medical device at some point. Then the next topic would be use of ISO 14155 and ethics committee votes. I mean, if you are not a legacy or don't have a legacy device and work on a new MDR device and have to run a clinical investigation, like there won't be a lot of ways around learning that you have to do that. But let's say you have MDD medical device, and you know that you need to collect clinical data for an MDR certification, and you have a clinical partner, and they write up your study plan, and everything seems cool. Like the university clinic is like on board. You like it. The ethics vote from the university ethics committee is done, ideally, and well, then everything looks good until you kind of get feedback from the clinical reviewer, from the notified body, who may be asking like, how did your data monitoring look like? Which let's say university clinics may not necessarily do on their own. Like, it's something that, I mean, following that ISO standard for clinical trials is something that's like the job of the manufacturer. But if you're not aware of it, and your university partner is mostly interested in publications, like, it may not come up until it's too late. And there are just a couple of things that are really, really hard to do retrospectively. So whenever you're setting out a clinical trial for potentially to be used for MDR purposes, like having an ethics committee, even ethics vote, even if not required legally, will be saving a lot of headache, as well as following the norm. And the typical thing that's missing is data monitoring. Then the next thing is a literature review. And like, which may sound a little strange for probably a lot of technical people, but I mean, not every literature review is the same, unfortunately. And like, let's say, ideally there is one done pretty early on, just to know what's like the state of the art, like what are other devices. But like, typically it's like let's say someone does it the first time, spends a lot of time on it, and then later on realizing, we didn't look for alternative treatment options, or we didn't really learn what are actually typical endpoints to kind of that you would compare your own device towards. So meaning like there are just a couple of outcomes that you want from a literature review, and just knowing that early on. I mean, given that you will spend time either way, but kind of a lot of time either way on literature review. But the question is like, do you do that twice or 3 times or just once? So meaning like knowing what you need out of the literature review is typically very helpful. And the second part here, oh, sorry, I have to go back to the presentation, is like, I mean, the expectation is typically like that it's like reproducible, and whatever that means. So meaning like if you invest a lot of time, like kind of talk to a couple of people, learn what is expected from notified bodies in that case, so that again you don't waste time, but you have it actually documented in a reproducible way, because it often doesn't add that much additional work, but it will yeah, again, save you a lot of headache later on. That, and I think there was one more point. Yeah, it is like the very boring point of having a logbook with decisions and kind of experiments or hypotheses and so on that you do. I mean, typically people do user tests, but even if you ask, I mean, I haven't met any startup that does do user tests. But if you ask them what was the objective that you were trying to find out with it, or like what did you actually test? Like let's say a couple of weeks or a month after that, there's typically not a lot of the outcomes or like the planning of that left. I mean, you don't need to document everything like a summative evaluation or not, but like at least having a couple of notes on like what did you try to do, what was the outcome, or like let's say for bigger architectural decisions and so on. Just writing down a couple of notes for bigger discussions can save a lot of time when later on trying to summarize and write things in the technical documentation.
What I saw, I had no idea what the other 2 presenters would present. So what I thought was focusing more on the interaction between notified bodies, and also set up the technical documentation and sharing what I learned during my time as a regulatory affairs person. I have a long background from regulatory affairs, but not pretty much with, say, software medical devices. So I started in 2012, 2014. I was full-time in regulatory affairs with high-risk medical devices, implants, biomaterials, also, say anything with a medicinal product inside. So very broad. And since 2018, I started with software medical devices. I was part of one of the first pilots for MDR certification for software in the US. So that's my background. And since then, I've always worked with software medical devices, although I'm definitely not a techie, and I'm still working on getting more grip to the technical side of the whole thing. So my first part is I would like to kind of give you 3 sentences to keep in mind when you're writing a technical documentation or putting your things together for a technical documentation, or also interacting with a notified body. So first, my thing is NAA, never assume anything. Don't assume they understand anything about your device. Everything you want them to understand, because you want to build some rationale upon it, you have to explain it to them, and you have to explain it in detail. They have no idea. So don't assume that, oh, they have pretty much experience of everything. You may be different, or you may be special in certain kind of things. So never assume anything. Same thing also, they won't draw the conclusion from facts. So it's not enough that you listed that you all have done certain kind of tests. Draw a conclusion, says we did X, Y, Z, that's why we're compliant. The same thing is also, if it's something that's obvious from your perspective, just state it. They don't want to think, they just want to see that you have drawn some conclusions. So make it easy for them to find the right things. And so nothing is self-evident. You need to collect and provide evidence. So even if you think that you're kind of repeating yourself, just be very clear about what you're stating, because the manufacturer gives a declaration of conformity. So you think you are conformant. Only thing what the notified body is doing is they look at your things and just want to find what the right thing is. So never assume anything, always state what you want to say and what you want them to understand and to know. Second point is, there is a nice saying in German, der Wurm muss dem Fisch schmecken, nicht dem Angler. I think I tried to find an kind of translation for this in English, and it seems it's look like bait the hook to suit the fish, not the fisherman. Or I think all you can say, put yourself in the shoes of an auditor. You don't want them to ask any questions. So make the life of the auditor or the assessor of your technical documentation as easy as possible. Don't let them search for any evidence. Be very clear in your titles of the documents. Have numbers of documents, have hyperlinks. Just be very plain in what you kind of lay out and give them a kind of red line, what to look for. For the quality management as well, I always suggest to kind of create a quality management systems like a summary, something which helps you to find out if you are compliant. It's like a gap analysis, putting all the applicable ISO 13485 clauses in a table and putting next to it what kind of SOPs, work instruction, what are your elements of the quality management system apply or kind of cover these kind of requirements of the ISO 13485, and do the same thing with the MDR Article 10.9, so anything with the responsibilities of the manufacturer. That helps you. That's your manual. That's the summary you can have in your hand when you're going through the audit. Just be very clear. That's the way to follow. You have thought everything in your mind, how you kind of cover all the clauses. Just write it down, and that's the summary. That's the manual you go into the audit. Same thing also with technical documentation. I have very good experience in using kind of, I call it SUMO-TD, Summary of Technical Documentation. And I know that is really well received because it gives you a red line. It's like an umbrella document. You go all through all the clauses of Annex 2 or the MDR, and you add something with the post-market surveillance as well. At the end of it, you go through the different phases of your development, and you put everything in there, just like a very small summary, and then references to all the documents. So everything which needs to be known, and then additional hyperlinks to the documents where it's actually in there. So very clear, they have this manual to follow, and they can look at everything and have a clear reference. I know, for example, TÜV Süd has some kind of summary of technical documentation as a template, and that's also something which I recommend. If you have a notified body and they have available templates, use that from your notified body, or if it's not available, use it from another notified body. Anything which is guidance and templates from the notified body, also from MDCG within your technical documents. And also be sure to include elements they need to check off. If you find information about checklists or what they are looking for, use those elements verbatim, really, like they have to find it, put it in there, and they can check it off. Last but not least, don't think notified bodies are opponents. They are not opponents. They're actually, in comparison to FDR auditors, they are quite kind of agreeable. So the notified bodies usually want to establish that you are in compliance. It makes their life much easier if you find something that you are in compliant. They're not looking for gaps, they're looking for something to close the gap. So help them just obtaining the appropriate evidence. Just find something you can actually give them, and just make their life easier. If you have questions from your audits, if you don't understand the written questions, try to talk to them in person instead of trying out answers. Just find out, okay, what do they potentially, oh, I think we give this answer. If you're not sure that this is the one they're going to, just have a quick chat. Usually they're open to chats to find out, do I understand the question correctly? because that helps you avoid multiple back and forth between the notified body. It's timely and also costly. If you have done something in a certain way or differently to like a normal way, or even not at all, provide proactively justification in your technical documentation or also in your quality manual. If you say this is not applicable to us, you have to provide a rationale why not. And last but not least, notified bodies, they may not act as consultants, but however, if you can agree to a kind of technical meeting, you may present your approach and you can ask closed questions. So this is our way of going, and you ask closed questions, and usually they are quite open to kind of guide you in a certain way without being consultants. So these are my kind of learnings dealing with notified bodies, audits, and how to set up a technical documentation. And if you have any questions or comments, I say, well, this doesn't apply to me at all. I have totally different experience in the past years. I'm also open to hear your experience. Thank you.